Good day, class. So today we'll be continuing our lectures on the bladder meridian, and we'll be starting with DACHANGSHU, bladder 19. So this is the back shu of the gallbladder, and it is located on the back, approximately 1.5 cun lateral to the lower border of the 10th thoracic vertebra. And then if you look here, it's a back shu of the gallbladder. And what we know from our theory is that the gallbladder and the liver are a ZHONGLUSHU pair. This means that this point can also be used for disorders of the liver. You can see a few of them. This is stuff like bitter taste in the mouth, pain of the chest and hypochondriac region, and then it can also be used for other things such as jaundice, pulmonary tuberculosis, and tidal fevers. And then the needling, so just like the previous points, it's oblique insertion medially, 0.5 to 0.8 cun. And just remember the caution, we do not want to insert either perpendicularly or oblique but laterally, so that's towards the outside or towards the sides of the body, as both of these carry the risk of causing pneumothorax. So the next point is PISHU, bladder 20. So this point is the back shu of the spleen, and it is located also on the back, 1.5 cun lateral to the lower border of the 11th thoracic vertebra. So as you can see, as all the previous points, the distance from the spine is always the same, this 1.5 cun for all these points. The important part is to actually know which vertebra it's at. So for this one, it's T11. So it's a T11, T10, you need to know that. That's the important part here. And then the indications, if we look at this point, we can see it's the back shu of the spleen. So this means it can treat disorders of the spleen and stomach, as they are a ZHONGLUSHU pair. And therefore we can see the kind of symptoms such as epigastric pain, abdominal distension, jaundice, vomiting, diarrhea, edema, and anorexia, which are all related to disorders of the spleen and stomach. And then it can also be used for bleeding disorders. This is things such as profuse menstruation, dysentery, bloody stools, and then also because of its location, it can be used for back pain. Insertion, oblique insertion medially, 0.5 to 0.8 cun. That's exactly the same as the previous point, and again the same caution. The next point is WEIYANG, bladder 21. This is the back shu of the stomach, and its location is on the back, 1.5 cun lateral to the lower border of the 12th thoracic vertebra. So the important thing here is to remember the longitudinal measurement, and this is related to the spinal cord. So for this one, it's T12. And the reason for this is that all these points that we've done so far on the back have been 1.5 cun lateral. So that is the common distance, whereas the height is what changes between points. The indications for this point, so this is related to dysfunction of the stomach organ. So that'll be things such as epigastric pain, abdominal distension, anorexia, borborygmus, diarrhea, nausea, and vomiting. Our needling is oblique insertion medially, 0.5 to 0.8 cun, so the same as the previous points. And again, care against perpendicular insertion or oblique lateral insertion, as these can both puncture the lungs. The next point is SANJIAOSHU, bladder 22. So this is the back shu of the SANJIAO. Its location is on the lower back, 1.5 cun lateral to the lower border of the first lumbar vertebra, L1. So I want you to note here that we are now in the lumbar region. The indications for this point, it can be used for abdominal distension, anorexia, borborygmus, diarrhea or vomiting, dysentery, and indigestion. It can also be used for retention of urine and edema, and then because of its location, it can be used for pain and stiffness of the lower back. Needling, once again, we can go perpendicular, so it's perpendicular insertion or oblique medial insertion, 0.5 to 1 cun. And the caution here is against deep perpendicular insertions, as this carries the risk of injuring the kidneys. And if you remember from anatomy, the kidneys lie in this region. So that's why we have to be careful of going too deep in a perpendicular direction. The next point is SHENSHU, bladder 23. This is the back shu of the kidneys. This point is located on the lower back, 1.5 cun lateral to the lower border of the second lumbar vertebra, L2. So the important part again is the location according to the vertebra, and for this one it's L2. The indications, so firstly, this point is quite a frequently used point, and that's because of its location. It's used quite often for lower back pain. But the other indications, these are related to dysfunction of the kidney organ. So this is things such as weakness of the knees, blurring of vision, dizziness, tinnitus, deafness, edema, asthma, or diarrhea. These will all be due to dysfunction of the kidneys. Then also from the other function of the kidneys in governing the reproductive system, we can also use this point for dysfunction in the reproductive system. This is symptoms such as nocturnal emissions, impotence, enuresis, irregular menstruation, leukorrhea, and infertility. Insertion, notes again, we can go perpendicular again here. So it's perpendicular insertion, 0.5 to 1 sun. Also note the depth is not that deep, as we still have the risk of puncturing the kidneys on this point. The next point is QIHAISHU, bladder 24. So this point is located on the lower back, 1.5 sun, lateral to the lower border of the third lumbar vertebra, also known as L3. So let's just review what this means. If you remember, we find the 1.5 sun lateral by first palpating for the medial border of the scapula. So that would be around here. And then we take the midpoint between the medial border of the scapula and the spinal processes over here. And between those two will be the 1.5 sun mark. And then to get our height, we need to count the individual vertebra. And on each vertebra, there's a spinal process. You can see them here on the image, these parts. And what we're looking for, if you read out this line again, the lower border of the third lumbar vertebra. So the lower border, if we look between two, you'll feel this protuberance, and then there'll be a space, and you'll feel the next protuberance. So we're not looking for this part, because that's the middle of the depression. We're looking for the lower border. So that's just below the protuberance over here, this region. And then we're going lateral to that. So as you can see here on QIHAISHU, here's the protuberance. We're just below that. And the point you can see is just below that protuberance. So the indications for QIHAISHU, bladder 24, we can be used for borborygmus, irregular menstruation, and dysmenorrhea. And then because of its location, it can also be used for lower back pain. Our insertion, so yeah, we can go slightly deeper as there are no organs that we have to worry about in the close vicinities. So we can go perpendicular insertion, 0.8 to 1.2 tsun. The next point is DACHANGSHU, bladder 25. This is the back shu of the large intestine, and it is located on the lower back, 1.5 tsun lateral to the lower border of the fourth lumbar vertebra. And this point, as well as the previous 2 points, because of their location, are quite commonly used for lower back pain. And the other indications for this point can be used for muscular atrophy, pain, numbness, and motor impairment of the lower extremities, and sciatica. And then, because it's also a back shu of the large intestine, it can be used for dysfunction of the large intestine organ. This is things such as borborygmus, abdominal distension, diarrhea, or constipation. Needling, we're going perpendicular insertion, 0.8 to 1.2 tsun. Okay, and then the next point, PANGGUANGSHU, bladder 26, again located on the back, 1.5 tsun lateral to the lower border of the fifth lumbar vertebra. The indications, this is things such as abdominal distension, diarrhea, enuresis, and sciatica. It can also be used for lower back pain, frequent urination, and retention of urine. And these are all related to its location, where it's close to both the back and to the bladder and kidneys. The insertion is perpendicular insertion, 0.8 to 1.2 tsun. Next, we're looking at SHENSHU, bladder 27. This is the back shu of the small intestine, and it's located on the back, 1.5 tsun lateral to the midline, at the level of the first posterior sacral foramen. So as you can see, this is different to the previous one. We're no more looking at the lumbar vertebra. So the posterior sacral foramen are these little holes on the spine, well, on the sacrum, and there are 4 on each side of the sacrum. So we're going just lateral to those. And then the indications, so we can use this point for things such as lower abdominal pain and distension, dysentery, and diarrhea. And these are all related to it being a BACHSHU point of the small intestine. Then it can also be used for other conditions such as nocturnal emissions, hematuria, which is blood in your urine, enuresis, or morbid leukorrhea. And then also because of its location, it can be used for things such as lower back pain and sciatica. Needling, it's still 0.8 to 1.2 tsun. The next point is PANGGUANGSHU, bladder 28. This is the BACHSHU of the bladder. Its location is on the lower back, 1.5 tsun lateral to the midline at the level of the second posterior sacral foramen. So that is located over here. And we're going 1.5 tsun lateral to the midline over here. The indications for this point, so the first set of indications are related to it being the BACHSHU of the bladder. Therefore, it can treat disorders of the bladder organ. So it can be used for things such as retention of urine, enuresis, and frequent urination. And then due to its location, it can also be used for stiffness and pain of the lower back. And then its final uses are for diarrhea or constipation. Needling, we're doing perpendicular insertion, 0.8 to 1.2 tsun. The next point is ZHONGLUSHU, bladder 29. This point is located on the lower back, 1.5 tsun lateral to the midline at the level of the third posterior sacral foramen. So we're now located over here. We're going 1.5 tsun lateral to the midline. The indications for this point can be used for dysentery, hernias, and stiffness and pain of the lower back. Needling, it's perpendicular insertion, 0.8 to 1.2 tsun. Okay, now let's look at the next point. So this is BAIHUANSHU, bladder 30. So it's also located on the back, 1.5 tsun lateral to the midline, and we're now in the fourth and the last posterior sacral foramen. We're just lateral to it. And the indications for this point, so if you think where it's located, it can help you with a lot of the indications. So firstly, it can be used for enuresis and nocturnal emissions. It can also be used for local disorders such as constipation, tenesmus, and prolapse of the rectum. And then also for female problems such as morbid leukorrhea, irregular menstruation. And then it can also be used for cold sensation and pain in the lower back, or pain due to hernias. And the insertion and depth is the same as the previous points, 0.8 to 1.2 tsun. The next point is SHANGLIAO, bladder 31. So this point is slightly different to the previous points as it's no longer 1.5 tsun lateral to the midline. We're now going to find the next few points inside the sacral foramen. These are these little holes here in the sacrum. And this will be for bladder 31, 32, 33 over here, and 34. So how do we find SHANGLIAO? Well, it's on the lower back and it's in the first posterior sacral foramen over here. And then the indications for this point, so because of its location, it can be used for lower back pain, but it can also be used for dysuria or constipation. And then it also can be used for disorders of the reproductive system, such as irregular menstruation, morbid leukorrhea, prolapse of the uterus, nocturnal emissions, or erectile dysfunction. The needling, we do perpendicular insertion, 0.8 to 1.2 tsun. Next is SHILAO, bladder 32. It's on the lower back. It's in the second posterior sacral foramen, so we're in the second hole at the moment. Over here on the picture. And we can use this point for things such as irregular menstruation, leukorrhea, dysmenorrhea, also for men, nocturnal emissions, impotence, and then also related to the bladder, dysuria, enuresis, and then from its location it can be used for things such as hernia, lower back pain, and then muscular atrophy, numbness, and motor impairment of the lower extremities. Insertion, exactly the same as the previous ones. It's perpendicular, 0.8 to 1.2 tsun. And next is ZHONGLIAO. This point is known as bladder 33. It's on the back and it's now in the third posterior sacral foramen. So this point is used for things such as constipation, diarrhea, dysuria, irregular menstruation, morbid leukorrhea, and then from its location, lower back pain. Insertion, exactly the same, 0.8 to 1.2 tsun perpendicular insertion. The next point is SHENSHU, bladder 34. This point is also located on the lower back, and we're now in the fourth and final posterior sacral foramen over here on the image. There's indications for this point. It can be used for lower abdominal pain or constipation, dysuria, morbid leukorrhea, or because of its location, lower back pain. Needling, it's perpendicular insertion, 0.8 to 1.2 tsun. Next point is WEIYANG, bladder 35. So this point is located on the lower back / gluteal region, and it's 0.5 tsun lateral to the due meridian, level with the tip of the coccyx. So what does this mean? Let's bring in an image of the sacrum and coccyx. So you see this image here, you can see that the sacrum and coccyx form an upside down triangle with the tip pointing downwards. So what you're going to do is you're going to palpate from the spinal cord down to the sacrum, and then you're going to keep palpating down until you can feel this tip here, this part here, and that is the tip of the coccyx. And then we're going to go 0.5 tsun lateral to it. And the indications for this point, so this point can be used for dysentery, bloody stools, diarrhea or hemorrhoids. It can also be used for impotence or morbid leukorrhea. Needling is perpendicular insertion, 0.5 to 1 tsun. Next point is CHENGFU. This is known as bladder 36. This point is located in the gluteal region, in the middle of the transverse gluteal crease. So what this means is this is the gluteal region over here, and what we're looking for is the middle of the transverse gluteal crease. So the transverse gluteal crease is this crease here, formed on the back of the patient, and you're going to find the midpoint of this. And normally this point is located with the patient lying down on their stomach, so that's the prone position. Indications for this point, so it can be used for pain of the lower back and gluteal region, that's due to its location, but it can also be used for muscular atrophy, pain, numbness, and motor impairment of the lower extremities. And another important function of this point is that it can be used for hemorrhoids. Needling, we're going perpendicular insertion, 1 to 2 tsun, as this is quite a muscular area, so we can go slightly deeper on our insertion. The next point is YINMEN, bladder 37. So this point is located on the upper leg, 6 tsun inferior to CHENGFU, bladder 36, on the line connecting CHENGFU, bladder 36, to WEIZHONG, bladder 40. So what this means, as you can see quite clearly here on the image, it's on the upper leg, 6 tsun, here's the 6 tsun distance, below bladder 36, and how we find its line is we connect the line from bladder 36 to bladder 40, which we'll learn about just now. Sorry, that must be a straight line. And then the indications for this point are all about its location. So it can be used for pain of the lower back and thigh, muscular atrophy, pain, numbness, and motor impairment of the lower extremities. It can also be used for hemiplegia. Needling, again, this is a large muscle, so it can be perpendicular 1 to 2 tsun. Next point is FUXI, bladder 38. So this point is located on the lateral end of the popliteal crease, 1 tsun superior to WEIYANG, bladder 39, on the medial side of the tendon of the biceps femoris. So the first thing is it's at the lateral end of the popliteal crease. So this is the popliteal crease, and we're going towards its lateral or outside end. And at this lateral end is actually the next point, WEIYANG, bladder 39. And then from here, we have to go 1 tsun upwards, and we have to go along the medial side of the tendon. So this is the tendon of the biceps femoris here, and we've got to be on the medial side. And this image here just shows another view more clearly the biceps femoris. This is the one head of what we call the hamstrings, and this is the outer head. The indications for this point can be used for numbness in the gluteal and femoral regions, contracture of the tendons in the popliteal fossa, and constipation. Needling, it's perpendicular insertion, 0,5 to 1 cun. The next point is WEIYANG, bladder 39. This is a lower Hersey point of the SANJIAO meridian. And its location, it's on the popliteal crease, lateral to WEIZHONG, bladder 40, in the depression on the medial border of the biceps femoris tendon. So if we look at the image here, firstly we locate the popliteal crease over here, and then we're going to go to its lateral end. So the lateral end is over here. This is the lateral end. And we're going to be in the depression on the medial border of the biceps femoris. So the biceps femoris is this one we talked about in the last slide, this muscle here. And we've got to be just medial to the tendon, right there. The indications for this point, it can be used for distension and fullness in the lower abdomen, edema or dysuria. It can also be used for stiffness and pain of the lower back and cramps of the leg or foot. Needling, it's perpendicular insertion, 0,5 to 1 cun. Okay, so the next point is WEIZHONG, bladder 40. This is a Hersey and earth point, and it is at the midpoint of the popliteal crease. So you're going to find that popliteal crease again, and we're going to look for the midpoints. And then you also have to ensure that you're in the depression between the semitendinosus and biceps femoris. So that's these two muscles that form what we normally call the hamstrings, and you're going to follow them down to where their tendons are. And this point is located around here, so we're going to make sure it's between the two tendons. The functions of this point. So the functions of this point, I've highlighted lower back pain, as that's a very important function of this point, and we use it quite a lot in lower back pain. And then other functions is stuff such as motor impairment, numbness, paralysis of the lower legs. And then we can also use it for abdominal pain, vomiting, diarrhea, and we normally use it, if we're using it for one of these conditions, we normally use it as pricking to bleed. So we just prick the area to bleed. And this is related to it being a Hersey and earth point, so it can treat its associated organ. And then we also can use it for things such as dysuria, enuresis, erysipelas. And the needling, we're going to be needling perpendicular insertion, 1 to 1.5 cun, or prick to bleed. And when you're treating patients with lower back pain, you may sometimes see this on your patient. So if you look here on the image here, the left side here is normal, but you see on the right side here, you can see the distended blood vessels at the back of the knee. So what we would usually do in this case is we might prick to bleed the actual vessels, and this can help to alleviate the pain. So normally bladder 40 would be around here, so we might prick to bleed these areas here just to remove what we call the blood stasis here in the back of the knee, and this can sometimes help to alleviate the lower back pain. Especially you see this more commonly in acute conditions.